culture effortlessly. That's the way it was. Happened so naturally. Didn't I know it was love? The next thing I felt was you holding me close. What was I gonna do? I let myself go. Now I'm flying through the stars. Hope this night could last forever. I've been waiting for you. It's been so long. I knew just what I would do when I heard your song. Hey, 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 you guys. Yes. Yes. We made it back in here another Sunday. I'm so excited. I am so excited. This is one of my favorite shows. They're all my favorite shows. Who am I kidding? But I love when we get into the spirit, mind, body, and soul. And today we're going to be exploring the spirit through, mental health, as well as, medical mental health, as well as spiritual mental health. So I'm just excited. I mean, this is Spiritual Release 2020 Vision at its finest, baby. So I'm just really excited. But y'all give it up for 2020 Vision. Yes. Yes. I have two of my favorite people in the house joining me tonight. First of all, we have Dr. Crystal Colone. Say hello to the people. Yes, yes, yes. She'll be joining us today for her segment, Ask Dr. Chris. If you don't know, now you know, baby. Then we have no other than, now bear with me because, see, he has evolved since we've last, spoken and had him on the show. But we're so happy to have him back. So this name, I mean, we're gonna get into some things with just the name. So bear with me. We have Shaman Baba T, the Black Angel, the Light Bearer, or of light. Y'all say hello to Shaman Baba T.
I can't hear you.
Oh, okay.
We
There
got
we
you.
go.
Yes.
All right. Good evening, everybody. Hope everybody's doing well tonight.
All is well, definitely. So, yes, it's going to be a great show. But y'all know how I like to do before we get into the show. I want to do my shout outs and get into some TikTok videos. And we're going to get this train on the road. So, first of all, I want to shout out my makeup artist, Dina. Yes, honey. She beat this face, honey. Yes, yes, and yes. Also, my hairstylist, Kate Isha. She came in here and did a miracle with this hair. Y'all should have saw me before. I mean, y'all should have saw me when I first walked in here. I look like who did it and what for, but they did, they did this thing. I want to shout out some September, some Libra birthdays, or actually October. I'm sorry. September and October. So September the 27th, my brother Rockman, was his birthday. Happy birthday, big bro. A happy belated birthday, big bro. Then October, my other brother, my other Libra, Aziz, the CEO of Drip the Mic Network. It was his birthday. What up, what up, what up? And October the 1st was Tobias Trevelyan. Shout out to you, another Libra. Y'all, I think Libra season a little bit. I feel like I'm missing some birthdays. Don't be mad. Don't be mad. Just don't be mad. It means nothing that I'm forgetting right now other than I'm just not as prepared. That's all. It's on me. It's not on you. Anyway, happy birthday to the Libras. Shout out to you guys, Libra season, Isn't that like balancing no, is Libra balance the scales? No? Does Libra? Or is it judgment? Anyway, I feel balanced. So, Libra season is good. And you know what? Let's get, wait a minute. I almost forgot. Shout out. We're doing shout out. Shout out to the HAPA Awards. They're starting this weekend from the 22nd to the 24th. So, we got Michael Blackston hosting. We have Claudia Jordan and Cynthia Bailey hosting this annual HAPA Awards show. It's all about African Americans and Africans coming together and being celebrated for their contribution to the arts, to entertainment. Some entertainers at their finest. I know DeAndre is getting honored for being, a great actor, and he has a beautiful, wonderful story. Hopefully one day we'll get him on the show to tell his story, but he's being honored. And I'm actually up for the Best New Independent Artist of the Year award. Yes. R&B artist. Thank you. And I will be performing Friday the 22nd at the show. Yeah. It's the award show as well as the music, fashion, and comedy show. So I'll be, getting nominated as well as performing. Yeah. I feel like I've already won. It's just it's a good feeling just to even be recognized. So I'm pretty excited. Okay, so yeah, now let's get into the TikTok videos. Yep.
Put a finger down, adult ADHD edition. Put a finger down if you're constantly running late. Put a finger down if you find yourself interrupting while others are speaking. Put a finger down if you struggle with disorganization. Put a finger down if you love going on shopping sprees even when you're low on cash. Put a finger down if some days it's hard to get out of bed. If your whole hand is down, don't worry, you're not alone, and Cerebral can help you manage your ADHD online. With Cerebral, you can access licensed counseling professionals, get prescription delivery services, and start for $1 a day.
I picked that one because I thought it was a little relative to what we're going to be talking about today, mental health. But I also was curious, like, Crystal, in your field, you're the professional here. Are those symptoms related anyway to adult ADHD?
I mean, yeah, but I don't think they can kind of diagnose that like
It's like, is it random or is it just like that's everybody?
that's everybody. I'm like, what? Cerebral? What the?
Oh my God.
I'm gonna have to give me a little app too.
I'm telling you, that's where the money is, baby.
You can't comb your hair? Put your finger down. You running late? Put your finger down.
I know. I was like, wait a minute. Do I have adult ADHD? And then the shopping sprees one for me. That's the one that got me. Like, wait,
Don't get me wrong. There are similarities that come with having adult ADHD, but there's other diagnoses that you can have or not have. And be totally fine. I mean, don't get me wrong. I've already told you, like, everybody's got something.
Something. We all got something going on,
But I think that's a bit much. Because you've been late or you have a shopping spree or, no.
What'd you think, Shaman? Baba T, what you think?
I would have to agree. I might have to go back and see my therapist. I think I've been misdiagnosed. No, I'm just kidding. So yeah, I would definitely agree with her. Like that's a lot. I don't think that's everybody in the world, especially in the U.S.
Like that's the problem. We're diagnosing everybody with just something. Oh, you know what? You got something. Whoa! I was totally fine until I just wish that we would get past that because that's why people are scared to go to healers and professionals because they automatically say, oh, girl, you know what? They're going to say, I have something.
Right.
Yeah.
I feel you. Okay. Well, that's that. So let's go to the next video. And wait, who posted that one? Cerebral. Yes. Shout out to you. Thank you for content. I'm always perusing the TikTok videos and, YouTube and things, finding things interesting to talk about or show on the show. So, and then for those of you that have actually started submitting to me, thank you so much. I appreciate them. I see them. I want you to know I see you, and I want you to know that I will use your video. And if I don't do it this week, don't worry. It's probably more applicable for the next week's show. So, but thank you guys for submitting the videos to me. I'm watching them. I'm looking at them, and thank you guys for continuing to post, giving me great content for 2020 Vision. Tony, what's the next video, please?
Thank you for breakfast.
All right, no problem. Hey, can I just come inside for a little bit, to talk and chill?
Yeah, but my son's home.
That's cool. I'm great with kids.
But he's in his room, so it'll be fine.
All right.
Come on.
I hear you calling
How you bring some food back? Oh, what's good, my nigga? Hey. Did you bring the food?
No, honey, I'm sorry, I didn't.
All right, I'm about to go to the bar with my friends.
That's your son?
Yeah.
That's a grown man.
He's only 24.
How old are you?
I'm 52, sugar.
Hey, my dude, you think I can borrow your car keys?
Yeah.
Good. Y'all want some?
No.
Oh my God, I love it.
Let's say that I'm probably in that category.
All I can say is message. Like,
I would say you both are for sure.
See how you gonna just, you know what? Ain't nobody tell you to come over here and start snitching. I ain't tell you
like,
to
nah.
just start. You just supposed to shake your head and smile. You're supposed to, yeah, you know you right. Y'all both old as hell. No, Shaman.
No, I'm not.
You here to
y'all.
heal,
I'm just saying
okay?
y'all-
I thought you're here to heal us, okay?
I got you.
Who can we shout out for that video, Tony? Moscow. Oh, you're doing something. Okay. If I would just pay attention to my engineer, he got me on lock. Okay. Moscow 709 or 709. Thank you. Shout out to you for posting that. Thank you for that one. That was hilarious. Okay. What we got next?
How you mad at me because I don't want to give you no cat? My mama and God gave me this for my birthday. I am the rightful owner of this pussy.
Message. Shout out to you out there. You know who you are. Okay. Crystal, what you gotta say?
Oh man.
I got a right to throw some shade every now and again. I mean, I'm always Miss Smiles and Sunshines, but every now and then I gotta throw some shade. Anyway, I'm listening to you, Crystal. What you got to say?
I had a conversation with my daughter that's about to go to college. I'm like, that pussy belongs to me too.
Right.
So
wow.
they're gonna have to ask permission because I have to pay for school.
You know.
Fine.
You bought and sold, baby.
If you're gonna go on a date, we're all going on a date.
I know you have a daughter, Shaman Baba T.
I do.
What say
and,
you?
You know, I kind of talk to them the same way.
Yeah.
You know, you're not obligated to give up anything to anybody. I don't care what they say. You do it on your terms, and you make sure it feels right from within.
That's right. That's right. Yeah. Amen. Hallelujah. All right. What do we got next? Oh, Skylar Loren. Shout out to you. Thank you so much. Thank you for that content. We watching you, girl. All right.
We're becoming addicted to being alone, to feeling peace, to having our own space, to not giving no damn explanations, to not letting just anyone into our hearts or our skin, to becoming self-sufficient and shining alone. And it's not fear, it's self-love.
Shout out to self-love, self-care. You know, that's near and dear to my heart, as well as just kind of relative to the subject at hand today. So just wanted to share that one. And who was that I have the pleasure of thanking and shouting out?
We're becoming
Bianca Mali. Bianca Mali, maybe? Really? All right. So, yes?
I was going to say, you know, right before that video played, I asked the ancestors, what deck should I pull out for this session tonight? And it's the love deck. So that video is so appropriate for what we're talking about.
Yes, and yes. All right.
I'm thinking something nasty. You said love deck?
Crystal,
Love it, dick.
ain't nobody messing with you, Crystal.
Dick.
Crystal, cut it out. How you gonna get started already?
I love that. Wait, you said dick? What did you say?
No, deck.
DECK.
Oh. I'm gonna need to see that video again. I done lost track. I was like,
Anyway.
They ain't got nothing to do with you.
Do you have anyway, I'm not even going to go in there with you, Crystal. You almost had me going in there with you. I have to get back on track. Tony, we got one more? Okay. All right, we're going to show this last one. And yeah, check it out.
Honey, I see you looking at me. I'm ready to go with you if you want
Sexy.
me. 'Cause baby, there's no one that makes me smile.
Yeah. Who posted that one?
Okay, it said something like with the eyes or something, because I wasn't paying attention.
Why wasn't you paying attention? Now all the rest of the boys and girls in the classroom got to wait on Crystal Colone. Shaman, can you please explain to your fellow classmate, Crystal?
You had this naked man.
Oh God, did you see him? Anyway, Shaman, can you explain to your fellow colleague what's going on?
I guess in mental health that would be called distractions.
See how you acting like that?
No, I'm just kidding. I'm not gonna hate.
I swear, I done got so many parents. Tony, ever since I've been a single woman, I have so many moms and dads. I didn't even know I had this many moms and dads. You can't go outside. You can't look. Don't look at that way. Turn your head straight ahead. You know. All right, you guys, it is time to get this show on the road. As I said, this is one of my favorite subjects to speak about, mental health and spirituality, just health, period, uplifting, uprising. And sometimes you have to go inward and heal yourself in order for that uprising, that upliftment to happen. Today, I'm so proud. I'm so proud of these, our two guests that's here. You guys hear me talk about Dr. Chris all the time. Yeah, I call her my shero sometimes. I'm really proud that she's gone as far as she's gone in her career and in her education and just being a thorough, full-fledged healer. Every sense of the word, she she set out to heal people and she took it very seriously. And so she's here to speak to us from a professional standpoint, a medical professional standpoint, as well as Shaman Baba T, the Black Angel of Light. He's also here to speak with us from a professional standpoint within spirituality. So he's just as educated as well, but he performs his healing through spirit, just flat out using spirit, which you find in yourself, and he's able to help you bring that out in yourself and teach you how to heal yourself through techniques that he's able to give you and show you and actually practice on you. So merging these two worlds together for me is everything, because it is all relative. We often try to choose between mind and spirit or mind and heart. And you have to understand they occupy the same body. They have to work in conjunction. And when they start to work in conjunction, that's when you'll have true alignment. You guys, help me give Crystal Colone, Dr. Crystal Colone, and Shaman Baba T a warm 2020 vision welcome. Crystal, I can't hear you.
Oh, you can't hear me?
Turn her up. Can you turn it up from there? Okay, got you.
Okay. I thought it was me because, the text stuff in there.
Mm-hmm.
But I want to first start off by saying, thank you very much for having this platform where entertainers and professionals can come and speak their truth.
Yeah.
And share their gifts and their professional talents. I I really commend you on that, and thank you for always having just such nice things to say about me. I appreciate that.
They're
It's like,
true.
I'm not that mean doctor. Okay. Um,
They're true. You actually got a big heart, a huge heart. I've seen you in
cool.
action.
Um, I just feel like it is so extremely important for, you know, us as people to just have a platform where they can come and where it strengthens them
Mhm.
and also just fills them,
Mhm.
because it's just so many people who feel like they can't let it out,
Mhm.
can't get the help that they need, and even if they can just hear it,
Mhm.
or if they can get that information, especially with the healer or myself,
Mhm.
where they can call in and um, seek services.
Mhm.
That's like the highlight of this whole thing for me. So I thank you, because a
You're
lot of
welcome.
people are not doing it and they might be scared to do it or whatever may be the case. But I thank you for that.
Yeah, you're welcome. You're welcome. More than welcome. Well, we want to get into your excuse me. We want to get into your business. We want to dig into you, and this Ask Dr. Chris segment. And I want to start out by asking some questions, and then later on we will open it up to the phone lines. Anybody that wants to call in and or chat it up. We're streaming live on Facebook, as well as YouTube, and we have some IG watchers behind the scenes. And yeah, if you guys can type your questions in there, I can definitely relay them as well. So later on, we're going to open it up for the people. But I just want to dive in and ask you about your journey in the, what was it? I want to say, correct me if I'm wrong, psychiatric field. And, the type of, and I know you can't talk about your patients, and I would never ask you to do that, but just, are you seeing mental health issues amongst the younger people start to happen more often than not, or has it always been this way and we're just now paying attention to it?
Um, so to answer your first question, I do neuropsych.
Okay.
So they're a combination
Okay.
of the brain as well as mental instabilities.
Okay.
I've always seen children all the way up to 108. I think that's my oldest patient.
Okay.
Um, but in saying that, when I do see the children, they're usually coming in for like an ADHD type thing,
Okay.
not necessarily a mental instability when it comes to moods.
Okay.
Um, however, since the pandemic,
Mm-hmm.
um, and the isolation and just some of the things that have come along with the pandemic,
Mm-hmm.
um, I'm starting to see more children.
Okay. Okay.
Um, More children who can't cope, who can't handle isolation, who now have social anxieties. Um, and I think that just has a lot to do with being isolated.
Okay.
Kind of reminds me of like the Spanish flu type thing, that
Okay.
some of the things that the children went through during that era.
Wow. You say like the Spanish flu. So they're are they not being able to cope with the losing of people, the being, isolated, being cooped up in the house, you know, what is what seems to be the trend amongst them, if you will?
I think it's a broad spectrum of things,
Mhm.
but if I had to maybe single out one of those
Mhm.
things, it would definitely be more of the isolation,
Okay.
not the necessary loss.
Mm.
And that's kind of surprising because, with loss, you expect a certain kind of attitude, mood, and
Mm.
kind of the stages of grieving. And I don't see that as much. I see that more so with the isolations, not being able to be around friends, not being able to do the things that you're used to, hug, kiss, whatever
Mhm.
may be the case. And so I'm starting to see more problems with that. I know that you asked the question, um, is this something new or do you feel like it's been there? Now, even though it is something new, that's something I have been seeing, I don't think it's necessarily new when it comes to um, them having that condition.
Okay.
I it's kind of, now I can label it,
Mm-hmm.
and I can say, oh, it's because of the pandemic. And
Mm-hmm.
then like when you're talking to them and investigating, you're like, well, I'm looking back here and you're saying that this started when you were 6 or this
Okay.
started when you were 10.
Yeah, okay.
And you're now able to run out and seek help because now you have maybe an excuse or a reason.
Okay. I get it. Yeah, I get
And
it.
in actuality, you probably should have seeked out help a lot sooner. But I know the fears and all the stuff that comes with it.
Mm-hmm. So, from a, you said neurological, right? Um, just explain that to me. I was going to try to find some cute question to ask, but what is that when it comes to mental health? I understand it's working with the neurals, but like, what is that? Can you explain that to me in layman's terms?
Well, kind of like your healer, he doesn't just work on one spectrum
Okay.
of mental instabilities.
Okay.
And I don't think that anybody should work on one spectrum when it comes to um, any mood issues or any anxieties or depression or anything like that. So it's easy for people just to label, oh, I'm depressed.
Mm.
Why are you depressed?
Mm-hmm.
And a lot of times, as professionals, because we are overworked and kind of busy, we kind of negate everything else that could be causing those issues
Mm-hmm.
and not investigate those things. So that's where my specialty comes in. I try to look at everything as a whole so that we can come to a bottom line of what might be causing you the issue. Who who can't say they've been depressed or had a depressed moment?
Right.
But is that depressed moment coming from um, an aspect of the brain? Is it coming from a traumatic stress? Is it coming from a traumatic event? Is it coming from a head injury?
Mm-hmm.
Is it coming from just basically a chemical imbalance? So if you don't look at the body as a whole, you'll be treating each and every symptom
Mm-hmm.
individually and definitely harm the patient
Right.
or the person. So that's where neurology for me comes in. I look at every single thing. Okay, we're going to do some blood work. We're going to do some this. We're going to do that. And make sure that nothing else could be causing
Mm-hmm.
the way you're feeling.
Mm-hmm.
Because I think that what a lot of people forget is that normal little things can cause you to feel that way. And
Mm-hmm.
it's not necessarily because you are a depressed person or you have a bipolar or a mood disability. Prime example, like I have patients come in and they're like, I'm depressed. I've been like this. And I'm like, well, how long have you been like this? And it's not been very long. And so I'm like, well, let's do some blood workup. Let's check your thyroid. Let's check your hemoglobin A1C, which is for diabetes, so that we can make sure that this is a true depression or psychosis and not something driven by something else that's happening.
Mm-hmm.
And a lot of times is something else that's happening. They don't understand that other diseases are related
Mm-hmm.
to those instabilities.
Yeah. So it's truly mind, body, soul. You know.
Absolutely.
Have you ever had to just basically send someone home without any uh, diagnosis or any medicine, and just say this is, something that, maybe giving them something that they could work on mentally or emotionally on their own that didn't need any aid of medicine or, or even calling it anything? Have you had to send patients home in that manner?
You'll be actually surprised that I send almost all my patients home with our first meeting with no diagnosis.
Wow.
Um, I have a very intense and thorough um, interview process.
Okay.
Um, um, but at the same time, even if I am leaning towards several diagnoses, because from the interview, of course, I would know if you had some traumas or if you had this or if you had that.
Mm-hmm.
Just because you've had traumas doesn't necessarily mean you have post traumatic stress.
Okay.
Because some people can have traumas and not really embed that into
Mm-hmm.
their life.
Mm-hmm.
And at other times, women, men can have traumas that they don't even know are related.
Okay.
Like something that could have happened to them at 7 years old,
Mm-hmm.
and they're now 40 years old, and they're like, well, I don't think that's related. Well, guess what? It's absolutely related.
Okay.
Because when you're 7 years old, you don't have any control. You can't say no, yes, whatever may be the
Mm-hmm.
case. And then at 40, 50 years old,
Mm-hmm.
now you have that opportunity to say no, yes. And at the same time, it comes along with a lot of emotions,
Right.
whether that's anxiety or anger.
Mm-hmm. Mm-hmm.
So almost 100% of my patients, they don't go home with a diagnosis.
Okay.
The ones that do go home with the diagnosis, they're on the more severe
Mm-hmm.
side,
Mm-hmm.
because I do trauma psych,
Mm-hmm.
and we already know that it's a major issue, and they have probably already been treated before.
Right.
And now this is just something that either the treatment is not working,
Mm-hmm.
or they're looking for alternatives.
Right. Okay. Yeah. I don't want to, hog her all to myself. Shaman, did you have any questions that you wanted to ask?
We can't hear you, baby.
Definitely want to say that, I appreciate your explanation, doctor, because that's exactly how it worked for me. It was 10 years after war that a doctor said, "Why haven't you been to counseling yet?" And I was going through some mental things, some physical things, and I didn't think it was related. I felt the same way. That's 10 years ago, and she said, "No, that's all related. Like you went to war, you sing these things. You need to, get checked out." And I was glad that she recommended it, and I was glad that I followed up with it because it did help me a lot, and it was directly connected, even though I didn't realize it was. So, yeah, I appreciate you explaining that because it gives me confirmation that I did the right thing.
Okay. All right. All right. All right. Moving on down this train. So, now I know you've worked in different fields, Crystal, of, in regards to being a doctor. I know it was ER, gynecology, I can't name them all, but,
I've done them all. The only one I probably have not done as much is cardiovascular, but
Okay.
I've done every single part of medicine.
Okay. Do you have one that you favor or gives you the most purpose?
Actually, you know how like you ask somebody, that question, and it's
Mm-hmm.
like, oh my God, because it just makes me light up.
Mm-hmm. Mm-hmm.
Because to tell you the truth, all aspects of medicine
Mm-hmm.
still equally intrigue me and make me happy and satisfied.
Okay.
Um, but I will say that now just doing like psych
Okay.
and substance abuse um, for the last couple of years, um, that has probably been the major thing that has really brought me um, a sense of I'm really doing something,
Mm-hmm.
because you can actually see the change.
Right.
I guess you can say, because I follow up with my patients, biweekly. We're not doing this 3 months thing. I want to see you every 2 weeks.
Right.
Um, just to start.
Mm-hmm. Mm-hmm.
But at the same time, I feel like that's probably been the biggest field where I feel like I've been the most helpful, and that might be because of the whole pandemic thing and
Mm-hmm.
just the increased awareness
Mm-hmm.
of mental health
Mm-hmm.
and substance abuse.
And I can tell too, because you do light up. Talking about medicine, period, like you said, you do light up. But I've known you for quite some time, and since you have been doing psych, it's something that I watch you light up about every time we talk about it, and you really get into it, and you just seem as if you enjoy it a lot, and you actually like to study. It's like you study your patients, so it's just like you're like, okay, let me see what happened. It's like,
And let me hear that again.
So yeah, I think you found it. I think you found your passion in medicine, even though medicine is your passion. With that being said, I also know that you're a very spiritual person as well, and I wouldn't say religious. I would just say spiritual. Ever since I've known you, you've been connected. And how do you feel that you merge spirituality with medicine? when it comes to dealing with your patients?
I think that that has probably been the most beneficial when it comes to me working in psych, because automatically they're assuming that, you know, my agenda is to push medicine towards them or to say that they're crazy um, for feeling this way. And me having that extra uh, ability, we'll say, to look at things as a whole and also use my spirituality in my sessions. I think that has basically increased my popularity.
Yeah.
um, and also kind of gives them a sense that I'm a real person. I'm a real person. I'm not somebody here just to try to, you know, push down medication down your throat, because necessarily you might not even need medication.
Right.
Even if you do have all these things that they're claiming that you may have. Because guess what? It's people living their life and able to live and be happy and functional, bipolar and all.
Right. Right.
So just because you feel like you have a condition doesn't necessarily mean that it is hindering you and hindering your life where you feel that, I mean, that you need medication.
Right.
That's all.
Yeah.
And then I also, you know, tell them to look towards their own spirituality and reach in there and basically find your own diagnosis. You can heal yourself. You don't need me. Now, me being there is probably like the extra push and the extra guidance, but at the same time, you don't need me.
Wow.
How was people functioning back then?
Yeah. Yep.
They didn't need me.
Yeah.
They didn't need medication. They didn't have all these nice medications and dopamines and receptors to help you get past certain things. Trust me, you can do it yourself.
Yeah.
But at the same time, I do recognize that some people do need help. I would never stop you from getting help. If you feel like, hey, you know what, I feel like it's something and you don't know what it is, definitely talk to somebody. And I recommend you talk to a professional because they have something to lose. You're not going to talk to Pookie because Pookie is going to run with your information.
Right.
Especially when he gets mad at you.
Right. Right.
Versus somebody who has something to lose.
Right. Yeah. I agree. You guys, you know, this is our doctor, you know, our doctor at, well, I can't get it out. I'm so excited. Our segment with Dr. Chris Colone, and is also referred to today as Ask Dr. Chris. There you go. See, I was trying to say a lot at one time. That's why it wouldn't come out. So, you guys, the call-in number is 646-378-0355. Press 1 to be heard if you have any questions, or you just want to conversate with the doctor or the shaman about something that's going on in your life. Not, you know, we don't need you to tell your business, but, you know, if you just want to get on here and chime in, definitely give us a call, 646-378-0355, and then you press 1 to be heard. And in a second, we're going to also look at the chatters. So chat it up, put questions on here. Let us know you're out here chiming in with us, and we'll definitely read some of them on air. Okay, so Shaman Baba T, Black Angel, Reiki Master, Healer. Oh, man, this has been a wonderful conversation so far. I want to pull you in on the conversation, and I want to start talking about, you know, what Crystal left off with, and that's going inward and finding healing for yourself, and how you're able to help with that for people. Because even though it's inside of you, some people have a hard time. Actually, most people have a hard time going inward to find healing for themselves. So could you tell us today about some of the things that you are able to do to help people heal themselves?
You know, one of the things the doctor said was about sometimes you don't need us, right? Sometimes you don't need us, you can do it yourself. But we're here sometimes to act as like a liaison between you and your own inner self, and help connect the mind, body, and soul so they can work in unison. And so what I do is that I go into the darkness of the person. The darkness simply means that is what's hidden. And so I go and I use my divine abilities, or some people will call psychic abilities, to see where in the darkness is the disconnect from the symptoms that the person may be having. And then once I'm able to see those visuals, or sometimes even my physical body will have a feeling, then I'm able to explain what I felt, what I saw, what I heard. And then it usually acts as a reminder to maybe a traumatic event that happened so long ago that's connected to the current day symptoms the person may be having. And so that's my role.
Okay. And okay. So there are certain things, certain techniques that you do to bring this about, or to help them through their trauma or their pain or their darkness. And there was something we was actually discussing yesterday that you told me about it. I keep hearing it. It's kind of like a trend lately. I keep hearing these phrases. And I said, what exactly is that? And you explained it to me so eloquently. I wanted to bring it back up. So shadow work. We keep hearing a lot about shadow work. What is that?
Yes. So shadow work, when people hear that phrase, some people immediately can be intimidated by it, right? And when we think of our shadow, again, it leads to the darkness. It's something that's hidden. And so when we say shadow work, it's very simple. It's simply just going within and asking yourself, why am I feeling this way? Where did this come from? Where is the activating event that caused this issue to magnify? Shadow work is simply just going within and allowing yourself to see the root of the problem, working it all the way back, and then healing forward from that root.
Okay. So one thing you said to me too was, we do it all the time. We just didn't know what to call it. Even with Crystal saying earlier, she was saying that certain symptoms or certain things that we've always had to deal with, we just didn't have a name for it. We didn't know what to call it. So this in turn sounds like that same thing. Like,
absolutely,
if you're interested in personal growth, I should say, you tend to do it all the time.
Absolutely.
So going inside self, trying to figure out, what's wrong so that everything can be all right, I guess.
Yeah. And in part of healing yourself simply is asking yourself, because yourself knows a lot about you, right? Because it's you. So simply saying, why am I feeling this way, can open your mind up to a world of, things that's going on inside of you that you didn't even recognize before.
And so you just gave us a technique. So this sounds like something you actually give to your clients,
Absolutely.
Okay. Well, y'all hear that? That was free game. It's real simple. Just go inside self and say, what's wrong? And it's also a caring moment, like, self-care, when you care for yourself and you treat yourself nice and stop beating yourself up. Because I know for me, a lot of times, if I feel like something is wrong and I feel like I'm doing something wrong, I'll beat myself up before I actually start the process of healing and trying to correct that thing. I'll just talk about myself to myself, like, what the hell you doing? Like, right. You know better than that shit. But maybe I didn't know better because maybe I never stopped to find out what was the root cause of that feeling for me. So, yeah, I can totally agree with that. Crystal, did you want to add anything to that?
The only thing I wanted to add, because it just kind of like just the spirit is talking to me.
Yeah.
Is that what I've noticed is that a lot of, not just necessarily people, just a lot of professionals that are here to help you don't help themselves and don't seek out the help. So I definitely want to reach out to them when it comes to seeking help within their own realm of profession, because I think that a lot of times they're overworked and they're stressed and they're not getting the sleep they need, and just most of the things that's happening with them, and they're kind of keeping it bottled up inside, and they're not able to receive that healing because they're equally scared or fear that they will be looked at in a certain way. So that's the only thing that I wanted to kind of just something was like, you know what, maybe you should speak about that.
If I could share something with you, Doctor, that I tell other healers, is to always remember that the healer needs healing too, right?
Okay.
So I mean, I don't know if I'm out of line by saying it this way, but I would say the therapist needs therapy too, right? I mean, and you're absolutely right. We do. We lose a lot of sleep. we absorb a lot of other people's energies and responsibilities, and we absorb their pain, and sometimes it brings us down. And we have to take time to reach out to somebody and say, hey, I'm trying to go within, but I'm a little stuck. Help me out, you know?
Okay.
So, yeah.
Yeah. And then we also talked about candle work. We talked about candle work yesterday. And, you know, I wanted to just kind of explain to the people without giving away too much, but explain to the people what, you know, what that is and just little things that you do to, you know, help out your clients when it comes to that.
So one of the things I do with the candles when it comes to someone who needs like a healing that needs like an extra boost, kind of what the doctor said when those severe cases.
Yes.
I like to use candles because I can use a candle that can be lit for a few days, and I can put the intentions. Usually I do it in writing, where I allow spirit to use my body to write what the intentions is needed for that person. So it's not my ego saying what they need.
Okay.
And then I like that candle with those intentions, and as that fire burns, those intentions are being either sent out to the person, or if it's something that the person is needing to be released, it's being released from them as that candle burn. And then sometimes I can even go and look at the candle afterwards and see a message in the wax. Once the candle has burned all the way down, that can give even more information about what may be going on within that person. And so, yeah, candle work is definitely something that's usually cultural, but when you look in the world, everybody uses candles, whether they realize they're doing some type of candle magic or not. Even if you're just lighting a white candle to honor your ancestors or honor God, that is candle work.
Wow.
So, yeah.
Wow. Yeah, that's deep. Didn't think of it that way. See, we be scared of things for no reason. You know, that don't sound right. That don't sound like something I heard before. People need to understand that if you're going to be here, you're going to evolve. You got to continue to evolve. And, you know, things will come to memory. Things will allow you to reconnect to your higher being, your higher purpose as you go on in life, you know. That's like saying that I got 5 years old and I should have known everything, you know, and I'm afraid of the things that I don't know, or I think that the things that I don't know must be evil. So, I'm real happy to know and understand these things, which leads me to my next question. I know you went to school as well. I know you're very educated in your field, even though it's spirituality. I know you're educated in your field as well. And I know that some of us, we went inward and received, you know, some knowledge as well. So with you, I feel like that you, a little bit of both. There's a combination of both. There's that education part, you know, books, you know, smart part. That then there's that actual spiritual part that you went in and received. So how does one acquire knowledge about healing from a spiritual standpoint if they're not receiving, or if they haven't been able to receive from the inside out, if that makes sense?
That's a great question.
Yeah.
So I always start with, usually if we're not receiving something, we have to ask ourselves, are we welcoming in the information? Are we welcoming in that information? It's just like with manifestation. Maybe we want something in our life. Maybe we want to do something in our life. But are we welcoming in what is needed for that to happen? So if a person wants to know how to heal themselves, one of the first steps is to welcome in divine healing wisdom. To actually speak it. I welcome in divine willing wisdom, divine healing wisdom that I need to heal myself on all levels. However the words come to you, but you got to welcome in that knowledge so it can start flowing through.
Okay.
Just to speak on that.
Okay.
I just have a question because Amira, she's gonna like kill me, but at the same time, Amira doesn't know that I think she has multiple talents. And one of her talents that I see that she probably doesn't really recognize that she has is the power to heal. So when a person doesn't recognize their healing powers, because they probably feel like they can't heal themselves, but they definitely can heal others. How do they enrich that? Is that by going to school or?
Well, to recognize it, again, sometimes spirit will force you in a position where you have to recognize So when I realized that I was a healer, right, I was having some allergy symptoms. And it was to the point to where both of my nose were closed and I couldn't breathe, I couldn't sleep, and I became desperate. The medicine was working. So then I go online and I say, okay, they say if you do push-ups, it'll work. And that didn't work. I did everything. And I became so desperate that I just sat on the steps in my house and I just sat there. And I said, look, I just need you to open. Look, just open. And it opened. And I said, whoa. You mean I could have just talked to my body and it would have did what I told it to do? That's all I had to do. So then I started dealing with my traumatic brain injury and say, wait, so I can push these migraines out there if I talk to my body. So sometimes we're put in a position where we're forced to know who we are. And that's how it happened for me. And once I realized that's who I was ready for it. I welcomed it, I embraced it, and I accepted it. And I'm like, let's get it, let's go.
Wow. Wow. Yeah, even with sicknesses, things that are you can feel a cold or whatever coming on. And a lot of times my God, I'm about to take a chance of saying this. People are going to be so mad. Protesters, it's going to be a whole protest outside of the studio next Sunday. I'm warning you, Tony, so don't get mad at me. But even when it came to the COVID thing, every time I thought any little thing was happening, I just told myself I don't accept it. And I felt better than, within instant, like, nope, not me, and even at some point, like if I actually got the scratchy throat or whatever, the first thing I say, I'm gonna go home and heal myself, because, I knew what I was gonna do when I got home. But even by the time I even got home, I was already feeling better because my intentions were set forth that I'm gonna go home and heal myself. And, I just refused to succumb to it. That's like, I'm not gonna accept it. That's not me. That's so not me, like. And so, yeah, I feel like the power of the mind is incredible and essential. So, and that's why I'm glad we're having this conversation, because we're talking about where mind and spirit meets and merge, so yeah. Yep.
Amira, that goes to boundaries, right? When we think of boundaries, we think of emotional boundaries. We think of boundaries that we set for others, where this is our physical body, this is our vessel. And guess what? I get to have boundaries in here too.
Ooh.
And if I say that this disease doesn't have a permission to live in me, then that's my boundary. I get to set that boundary.
Wow.
So that's what you did. You set a mental boundary to your physical body. You connected the mind and body and say, this disease does not have permission to live here.
Come on.
Therefore, the disease has to now leave.
Yeah.
This is how a lot of people even beat cancer with their mindset, because they say, no, I reject this cancer. And some people will say, I rebuke it. Some people will say, I command this sickness, this disease to leave my body.
That's right.
That is a boundary that we all can take in and set within ourselves. I commend you for, again, that's healing wisdom, knowledge that you had within you, and your own spirit said, girl, you can tell that thing to leave, right? And that's what you did.
Yeah, I love it. I love the word he said, boundaries, Crystal. I love it. Like, we talk about healthy boundaries, setting boundaries, even as we try to go through our healing process. And even if we've been traumatized by others, or even if we allowed others to traumatize us, the first thing we talk about is setting boundaries. And Shaman Baba T said you can set boundaries within your body, your system, to let sickness know that you have no dominion here. I love it.
I like the fact that he does that candle work, because I'm over here lighting all kind of candles. You know what? I'm just lighting candles. Oh, you know what? I just like the way they look. I like the way they smell. I'm about to burn the house down with candles. And don't even know why I'm lighting them.
Spirit moving you. Yeah, because Shaman, you was telling us that there's certain ones have certain meanings. Just give us like 2 different colors that has certain meanings, so that when we're in the grocery store or when we're somewhere and we grab, we're just grabbing a candle, maybe we can make sure we grab a certain color and that smells good.
So I like to burn the color of the candles depending on the chakra that's aligned with that color, right?
Okay.
So for example, if I'm burning a green candle, it's going to be either for self-love or some type of love or heart chakra healing, or because money also deals with green too, it may be for money. Maybe it's for business wisdom. Maybe it's to attract clients or attract, whatever you need in your financial life and your careers. And so, that's one I would use for that. But I also use green to remove money blockages, right? Those money blockages could be coming from within me, right? Doesn't mean something outside of me. Maybe I have a blockage that I need to release, and me burning that green candle with those intentions, the awareness of what the blockage is in me will come to me, and I can say, oh, that's what's blocking me. Let me release that, So sometimes, we can burn just for the sake of bringing that wisdom in that we need. Another one I've done for someone was a yellow candle.
Okay.
Because I'm about empowerment. Like, I don't want to just help you heal, but I want to empower you to know that you can heal and that you're stronger than you allowing yourself to know.
Yes.
Right. So maybe I might burn this yellow candle to boost up your confidence, boost up your self-esteem, just give you that extra boost that you need. And then once that candle magic starts to boost up your self-esteem, then your own self-esteem will kick in and say, oh, here we go. Now we can raise a little higher now.
I love it.
Yeah.
I love it.
Candles?
Some people call them spells. I personally don't.
No, I think she said sell. You said sell, right? You said sell? Do you sell candles?
Sell.
Oh, do I sell candles? No, I don't sell them. I don't sell them because I make other jewelry and stuff, and so making candles and doing candles is too time consuming for what I already do. But I do help people put the intentions into their own candles, and show them how they can go to the dollar store and buy a candle, and how you can do the same work.
Okay. Yeah, see. I like, and you like the sound of that too, Crystal. I was gonna say I like the sound of that. You do too. They got all kinds of colors at the dollar store.
Right. Dollar Tree.
What'd you say?
I want the candle that's been blessed.
Well, he said he can.
Well, those are things I can do. Like, someone can have their candle, and I can bless their candle. Even from a distance, I can still do the same thing because there's no time and space in spirituality. Yeah, that's not an issue. People send me their crystals, a picture, and say, can you recharge my crystals? And I look at the picture and I do my thing, and it works.
Yes. Well, let's open up the phone lines, and let's take some of these chatters. We do have a caller. We have Sean on the line. Are you there, and can you hear us?
I can hear you. How are you guys doing?
All is well, Sean. How are you?
I am doing amazing. Thanks for listening.
So you have questions or thoughts for either Dr. Chris or either Shaman Baba T, or both?
Well, I kind of have a question for both, really, but I kind of came in the middle of your what you guys were talking about in terms of like a spoken word. Essentially, what you're talking about is belief, and you actually saying something but believing it, because that's where the power comes in. And I'm curious how you help people to believe what they're saying when you're trying to teach them. Okay, look, you can choose whether or not you want to accept this or not, but it's more than just saying I don't accept it. It's actually you believing in what you're saying. So I'm curious, how is that taught? So that would be one question. And then for Dr. Chris, and I don't know if you guys covered this or not in terms of mental health, but with everything going on with COVID, and it seems like our government is, really trying to control us with fear, and how this plays into the mental health community. How do you address that with patients that are dealing with certain mental health issues, helping them to, I don't know, probably not even saying this right, but helping them to come to grips with what's going on and how you can help them through this while still addressing whatever mental health challenges that they have?
Okay, so I think the first question is towards me, right?
Yes.
That's a great question.
And I didn't
actually what I do.
Say your name, so I do apologize.
So
it's okay.
It's Shaman Baba T. Okay.
So what I like to do usually, typically when I'm doing like let's say a live, Facebook live, or I'm doing even a one-on-one session, or even when I do my Zoom session, my group sessions, right? I always like to do it by the numbers. I was in the Army for 15 years, and that's how we used to do it, by the numbers, right? So not only do I talk and teach, but then I like to demonstrate, and I like them to do an example so they can feel it, right? I want you to say this to yourself, and then when you say it, I want you to feel in your own physical body what happens, so that you know that it's happening. So I always allow them to have some type of like an exercise, I guess you can say, to show them that their words have power behind them, and allow them to feel it, allow them to say it, so that they know it's real.
Okay. Okay.
And as far as your question, it relates to mental illness already being present, and then just kind of what's going on now. I kind of approach it the same way. If something is already going on, we're addressing it, address that as well at the same time. The fear that they're putting into people, I'm noticing that, and coming out in anxieties. And so what I do is I try to address the anxiety portion and let them know, like, hey, like any profession or professional, yeah, stuff is going to happen. You're going to die. You're going to be, all these things are going to happen. There's no way for me to stop those things. But at the same time, the progression of the things and what you allow your body to, as far as believe, then that's what's going to happen to you. So I think we have to take steps back and not just necessarily give medication, but also just take steps back and let them know that, hey, we have to start from the beginning when it comes to this, and that's to address the fear aspect of however they're feeling.
And that's all from my point of view. I also address the fear aspect as well. Fear. When I look at the vibrations or frequencies, fear is a very, very, very low vibration, right? And it's hard to operate in love and enlightenment and fear at the same time. And so that is one of the first things I always try to reiterate, is that you have nothing to be afraid of, right? You have nothing to be afraid of. You have more power over yourself and over your surroundings than you think, so we start there. Let's get rid of this fear of what's going on first, so we can raise your vibrations to a more enlightened state, so that you can learn to be aware of something enlightened without necessarily being afraid of it. You don't have to be afraid. Once you know what it is, now we can do what we have to do to shift things around. Okay. So don't let enlightenment or awareness equate to fear, but let it empower you to say, now that I know, I can do something about it. So that's how I kind of approach fear.
Anybody in the beginning, because a lot of those fears and other things that is occurring during this situation, of course, is driving some of the root aspects or instabilities that we're seeing. And a lot of times, like, they automatically, I'm crazy. No, you're not crazy. Let's address these other things first, and let's see what's going on, because this might not necessarily be a true bipolar instability or whatever may be the case. This might be something else, in which it all equates down to is fear.
Yeah. Sean, are you there?
Okay, good.
Okay.
Yeah, I am. Thank you very much. I was just, struggling to hear a little bit, but I heard it. I appreciate you. Thank you very much.
You're welcome, brother.
Thank you for calling in.
No problem.
So did we have any chatters from anywhere?
You have a lot of people chatting, but and then in the YouTube, there's somebody that just joined for the first time. So thank you for that. But no questions. But
Okay.
I have a question.
You have a question?
Yeah.
Okay, let's hear it.
And this is actually for both, because a lot of people, even myself, I've done this many times, where you go through life and you get a block. Things don't seem to progress, or new traumas. But how do you know if it's a spiritual or a mental, and one is affecting the other? How do you break through a block that could, and you don't know which one it is? If it's a mental tragedy from, or mental, what do you call it?
Traumatic, traumatizing experience.
From a childhood,
Yeah.
or if it's a spiritual one as an adult. So how do you break through each side?
Ooh, that's a
great question.
Like
yeah,
that
that's a good one.
Okay. So from a spiritual side, right, we all have a divine purpose, a divine life purpose. And sometimes a blockage can seem like a curse, or a blockage can seem like something external is trying to prevent us from doing something. And sometimes that blockage is from within, because it doesn't align with our life purpose. So to save ourselves from going down the wrong road, the divine will place that blockage to say, no, you're not supposed to be going that way. You're supposed to be going this way. And so it kind of goes back to asking the right question to yourself, right? Why is this not working for me? Just recently, this happened to me, which you brought up. And I said, why is it that every time I try to do this on this particular app, things go wrong? And then I had to sit back and say, wait, am I even supposed to be on this app? Am I supposed to be doing this? And so then I took my material out and I did my divination, and that app never even came up as a priority. So I was like, wait a minute. So Spirit was really trying to redirect me. It wasn't blocking me. They was trying to redirect me because I was trying to do something, from my ego that didn't align with my life purpose. And so I always say, go back and ask, like, what is the blockage? Why is it there? Why am I not moving forward in this particular area of my life? And then it'll be revealed to you in sometimes more than one ways what it is. Either it's a blockage or you're supposed to be going to do something different.
For me, can you hear me? Okay. For me, that's why I deal with, I treat the body as a whole. I don't treat it as just one entity. So when a person comes in to me, that's why one of the other reasons why I don't just automatically diagnose them right off the bat, because there can be other things that is driving that instability. So therefore, when a person comes into me, I do my interview. I try to make sure that the spirit asks me the right questions to ask them so that I can kind of come down to a conclusion. So when it comes to that, I try to also use my medical knowledge to kind of collide them together so that we can have like a fine point. So I can say, hey, you know what? Whether it's mental instability or if it's a spiritual mental blockage, I try to align them together. So therefore, I can say, you know what? We don't know what it is at this particular time, but this is what it looks like. But we're going to do a kind of like what they call differential diagnosis in medicine. We're going to do a differential diagnosis. We're going to rule out all these other things that could be causing these symptoms or driving these instabilities. And then once these things are ruled out, then we can kind of slide it over to maybe this not being a true psychiatric or mental instability. Maybe it's something that's just plaguing you at this particular time that, I'm sorry, I don't know how to say your name, that he needs to help with the healing with. When it comes to that, I'm so sorry. I do not know how
No,
to
you okay.
Just call him the shaman. I just call him the shaman. Yep.
So I'm definitely one of those people that, I don't have to put medication on you. I don't have to have you say, you know what? Oh, you have a mental blockage, ADHD. I don't have to do that. I try to use everything that medicine has taught me as well as what I have experienced throughout just being in medicine for the 20 years that I've been in there, and try to collide those together. One thing that I can say when it comes to that, I always tell my patients, I know that this is the practice of medicine. Everybody's practicing, okay? But what you're hoping is that, hey, I practice long enough where I can say, you know what? I've seen this before. I've seen something similar, and this is kind of where it's guiding me. This is the point that I'm going with, and then it is leading me out to these things. And as a professional, I'm going to make sure that I rule out all these things before I start loading you with medication and thinking that this is the particular issue. So I definitely try to instill that in them, like, hey, everybody is practicing. I don't care who they are. But at the same time, you just want to make sure that that person has practiced long enough where they can say, hey, I've seen this, I've seen this. This looks similar, might not be the same, but it looks similar. And we rule out all these other things to make sure that it's nothing that's going to be detrimental to you at that particular moment.
So Crystal, just to kind of piggyback on what Tony was asking, because it's a really good question, and is there any mental disorder that you've personally seen or know of that causes you to just causes like blockages in your mind to where it just causes you to stop, to pause, to be fearful for moving forward? Like, I know that sometimes, okay, I'm going to be vulnerable as hell and give you a real life example. And this is some vulnerable, y'all be sweet to me, take it easy. But since I've been separated, for example, there's a lot of things that I didn't have to do by myself on my own or either handle at all. And something as simple as my battery dying the other day, and me thinking in my mind, first of all, this type of car batteries don't die, okay? So me going through that, then the whole thing of what do? I haven't had to handle this before, or not before, but in a long time. Or even if I had to handle this, I wasn't by myself. And so just those very simple thoughts made me feel paralyzed. I can feel my body physically go into a panic. And so while I'm not asking what to do, because I figured how to get out of it, I just wonder if is there something that, causes that other than fear? Because I was fearful to the point where I had to talk myself into what to do next. And it was very simple. Call the roadside assistance. You have it through your bank and your insurance, and you have it through Benz itself. So call roadside assistance. And just the thought of it taking an hour, just the thought of, what if they say something else is wrong, and then how am I going to get my car home, and then how am I going to get home, and all of that. I was literally paralyzed because I didn't have that other half there to even bounce it off of, or even call and say, hey, this just happened, or even that person wasn't even there to help me, even though I didn't need help. Like I didn't need that type of help. I could have, I could have handled it myself, but
right then and there.
Yeah, but something in my mind, and it felt like it poisoned my body and made me physically feel paralyzed and hurt. I was even hurting, like I could physically feel pain, and I was just, like going into a panic until I talked myself out of it. So have you seen that? I'm not asking you, do I have a disease? I'm just asking you, have you seen that related to any type of mental disorder? Have you seen that symptom related to something, if that makes sense?
Yes, I have.
Okay.
And what I want to start off with is, like, so many people are so caught up in labels. You have to label this with something.
Yeah, okay.
I have to have something.
Yeah.
It has to be this. It has to be that. When love is even a mental instability.
Ooh, come on, talk about it. Woo, they say it's the same chemicals go through your mind when love happens as it does going crazy. Yes.
In fact, when they do MRIs and CT scans, they're like, wait, the same thing is lighting up in this person that's not lighting up in this person. This person is loving and this person is not loving.
Yeah.
So those things are kind of in a collaboration. At the same time, is, again, not labeling anything. I don't think it's a label. But at the same time, when you've been in a relationship as long as you have, a lot of control, a lot of control factors that are in there, as well as fears and stress. Because guess what? If I'm kind of like our generation, and I think that's where I can kind of really pinpoint where some of the like my patients are coming in, and I'm like, you don't know how to do this? What's going on? Generational curses.
Yeah.
They come in, they're used to pushing a button.
Right.
I'm used to pushing the button. Like, I know I was talking to one of my patients, and I'm like, oh, well, do you know how to spell this? They're like, oh, hold on, I'm going to get spell check. What the hell?
What?
What's going on? Like, oh, I'm just going to look it up on the internet. Oh, I'll know how to do it if I look it up. So I just think that a lot of control aspects probably were mixed in there, as well as some stress and just also some fears. Because now somebody has basically took your job away from you, and they took their job away from them that they're used to doing, and now they're not doing it, and you're like, I don't know. I don't know what to do. Well, you do know what to do.
Right.
You were doing it before.
Right.
But at the same time, it's like, now I have to do it.
Right.
Kind of like if I'm pregnant for the first time, and now I have to be a mom. I'm not used to being a mom.
Yes.
What is going on? Girl, you was a mom. You was a sister to this person. You was a brother to this person. Who was watching them kids? Who was changing them kids' diapers? So same thing. That's the fear of you feeling that I don't know how to do it.
Okay. All right.
It just has to come back into our remembrance.
Yeah.
I have to remember that I can do this.
Yeah.
I can remember I'm a powerful being. I remember I'm the one that brought you up.
Mm-hmm.
So these are different things you have to kind of like talk to yourself about.
Yeah.
Balance. You have to talk to yourself about and say, hey, you know what? Oh, I know who I am. I almost forgot.
almost for 15 years. I almost forgot. Anyway, that's another conversation that we ain't gonna get into today.
Things that we have forgot.
Yeah.
And that just have to remember.
Yes. Yes, and yes.
And what she's doing is she's doing basically what I like to call soul retrieval.
Okay. All right.
And that's when you take the parts of the soul that's stuck in trauma, stuck in relationships, stuck in the past somewhere, and we go and retrieve that and bring that forward so that, you know, that you're whole again. And so I would just to say that you were in a temporary mindset of like maybe some unconscious codependency, right? Just some unconscious codependency at the moment.
Yes.
But because you have such a strong spirit, your spirit was able to talk you out of that.
Come on.
Right. You were able to retrieve yourself from that codependency in that moment.
Yes.
So that trigger may have needed to happen for you so that you can do that.
Yeah.
You know, sometimes the divine will put us in positions, again, to force us into being who we're supposed to be.
Come on.
That might have been just the case.
I receive it. I totally receive it because a week later, I washed my own car for the first time in a long time. And it was so liberating because usually, I'll go through the car wash, and I'm like, I see everybody over there drying their own car off and vacuuming their own car. I'm like, not me, right? But this time I went through and, it was me. It was all me. I had to do it all. But it was so nice. It was so liberating, man. I had the music going. I'm, vacuuming the carpet. Yeah, I'm like,
And then you just think, it's not that bad.
It's not bad at all. It was actually kind of therapeutic, and I actually got to clean the car my way, like the crevices that I think they always miss. You know what I mean? I'm like, how come they don't never see these crumbs in this between this and that? And I was able to take my time and do it all. It was good. It was, it helped me. So you guys are absolutely right.
Amazing.
Yeah. So there is another caller. It's they're from LA, I guess, because it's a 310 number. Caller, who's on the line, please? Hello. Caller, are you there? Do you want to be heard? Do you want to speak? Guess not. Guess not. Do me a favor, before we move on, can we read some of that commentary for those chatters if they're chatting it up? I want to hear what they're talking about online. Just a couple of comments that we might get a thrill out of.
Let's see. Well, most of them just like Dominique said, yes.
You know Dominique, Terrence?
I do. I know her very well. When I seen that comment, I heard it in her voice.
Yes.
Yes. And then Vicky was, hey there. And then, let's see. I have to click on, I don't want to click because it's going to say a bunch of names.
Okay.
But then, like I said, the people in the YouTube just said, hi, enjoying the first time. So
okay, wonderful.
That's live and uncensored.
Welcome. Thank you guys for chiming in with us. Have any questions or comments, be sure to chat it up online with us, as well as that call-in number is 646-378-0355. Press 1 to be heard, and the healers are in the house. I definitely want to switch gears just a little bit. Starting with you, Dr. Chris, can you give us any at-home healing advice that you would like to share with us and kind of just help us out? We all going through this thing together. So if there's anything that you can give us, please do.
I think you kind of hit it on the head when it comes to just kind of taking our own and doing things that are outside of the box, outside of the things that we probably would not necessarily do, because it is therapeutic healing in washing your car or exercising or doing any of those things. So take a step back and do something that you probably wouldn't necessarily do. Be adventurous. Speak to somebody that you wouldn't necessarily speak to.
Right.
It opens up all the endorphins and all these different things that you probably need.
All right. Okay. And Shaman Baba T, I was hoping you could share with us today one of your healing techniques that we could use at home, that we can do on our own. And we're here for you. We're open. We're ready. So anything that you're ready and willing to share, we're listening.
Okay. So one of the healing techniques is, first thing to do is stop. Just stop, right? Like whatever's going on, when you're in that moment, stop. Don't do nothing, right? And tell yourself to silence the noise around you. Silence the noise around you. This means not only the physical noise around you, but the the noise in your mind that doesn't even belong to you. You know, we absorb other people's thoughts because of what they said earlier or whatever. You want to silence the noise around you so that you can focus on you, right? This is also like a form of decluttering the mind. I like to call it decluttering. So commanding yourself to silence the noise around you. Then once you silence the noise around you, asking your higher self, which is your spiritual self, to tell you or show you what you need to do in this moment. What should I do in this moment? And then going into maybe a 3 to 5 minute meditation where you just pretty much sit still and just allow your thoughts to come to you naturally. Try not to control them, but let the thoughts come to you naturally. And what that means is that your higher self is now showing you the images, the pictures of what you need to see and what you need to address. Your spirit will always tell you what to do. Your inner self, which is your feelings, your emotions, will always tell you what's wrong. So you can speak to the inner self of you to say what is wrong, and then speak to the higher self and say, now, what do I do about it? If you allow yourself to go through that, you'll notice that you can come out of issues, very quickly. Using your situation as an example, your inner self said, you have some unconscious codependency. It didn't say that, but the way you reacted to that situation about the flat tire is pretty much what your inner self is telling you. But then your higher self came in and say, but now you can do this instead. You can call road assistance. You can do this. You can do that. So that is a simple healing modality that anybody can use if you allow yourself to just stop and be still, silence the noise around you, ask my inner self what's wrong, ask my higher self what to do about it. Now, when you think of the divine creator or God, when I ask my higher self, guess what? That's God too. When I ask my higher self, that's the divine creator, because we all one. We're all connected. We're all an image. So asking your higher self also involves your ancestors and God and your angels around you as well, to give you the knowledge and the wisdom that you need to do. It may say, hey, go take a shower.
Okay.
Right? And use that water to wash off the negative energy that you may be feeling at the moment. I love to say that every shower, it should be a baptism. Every time I get in the shower, that water has frequencies just like us. So if I talk to the water and I say, as you rain on me, wash away these negative emotions so I can see clearly. Wash away the mind clutter. Wash away, what doesn't serve my highest good. That is a quick cleansing, healing modality that you can do, that you should be kind of doing anyway, taking a shower. But you can also use that shower as healing as well.
Yes.
That's a very simple technique.
Yeah, I noticed the ancestors love to come around when when you're in water, when you're in the shower. What were you gonna say, Crystal? I'm sorry. Go ahead.
Bath for me.
Yeah.
Okay.
That's where I'm.
Absolutely. Yeah. Water is amazing when it comes to water and a clear crystal, a clear quartz, a clear crystal.
What I tell you your
and
crystal
water
was?
Acts as the very same.
What I tell you your crystal was, Crystal, about a month ago.
I'm telling you, she has abilities that she doesn't know she has.
I don't think I don't know.
Not that you don't know, but I feel like maybe you don't.
I don't practice them that. Yeah, I don't do them as much. And but Shaman Baba T inspired me, and I'm not gonna say what it is, yet, because I want you to, before we go, there's some things about you I wanted to show that you're doing new. So you kind of inspired me with something that I didn't even think about. But I'll go into it later. But yeah, you're right. I don't put it out there as much. But at this time, y'all, I'm a hustler, baby. So every part of me is about to be a brand except my hoo-ha, okay? I'm telling you, everything is monetized except my hoo-ha. That's the only thing I'm not monetizing. But everything else. My good time box. No, I'm playing. Good.
That little, now that he said, taking a bath and taking a shower,
yes.
I think that's what came up with the little vaginal steamy.
Oh, yeah. Huh.
No, I don't want to give nobody any ideas. Just cleanse it.
Because first you could find it in the Asian bathhouses, but now it's a thing. It's
now
the thing. So, okay. So what's next for you, Dr. Chris? What what should we look for with you next, and anything that you want to promote, any products that you have, anything that you want to promote? What's next for you?
Well, definitely my mind and my wheels have been spinning since we've been on the show, but at the same time, um, I don't really sell myself
Okay.
because I want to say that my reputation kind of speaks for itself. So I don't have anything to sell, anything like that. If I can be of any assistance or help to anybody, I can give you that number or where I am located. That
Okay.
if you need that assistance, but I don't have anything per se to actually sell or anything like that.
Okay. There's definitely going to be a time where you can give them all the information that they need to
Absolutely.
contact you,
No problem
and
at all.
yep, before we get out of here, you can let them know where to get you. And I'm sure at this point in time, there's probably a lot of people that want to sit down with you. You know, you provide a safe space. You know, your energy is beautiful. Her clients her patients love her. I've watched her work, and some of her I went with her a couple of times, and some of her patients are just like so happy to see her. They don't really need anything. They're just like, so my medicine is half empty, and she'd be like, let me see that bottle, and it's full. Or either they can't find the bottle that they claiming that need. Well, I don't know what I did with it, but it's half empty, and she be like, mm-hmm. But they just want to see her. They just want to be around her and absorb her energy. So, you know, this is perfect. This is everything. You know, so definitely get in touch with her. It is definitely a mind, body, and soul healing that you're going to receive just sitting down talking with her. And she's always been very helpful as long as I can remember, especially when it comes to medicine and healing. So what's next for you, Shaman Baba T? What we gonna look for? I think we can pull up that flyer that I sent you, Tony. It's black and gold. I think I may have even had to text it to you. Okay. I'm sorry. Go ahead, Shaman Baba T.
So the black and gold flyer that you're talking about, matter of fact, the young lady, Dominique Jones, who we read off, she's the one who created the flyer.
Okay.
The app is called Miko,
Okay.
M-I-C-O, and I'm a host on there. And on the app, I talk about a range of different topics from spirituality to, you know, even sometimes we even get into sex talk. But we talk about a little bit of everything. And even if we're laughing and joking, you know, it's still all healing when we're doing it. Also, I've been traveling lately. So I've been going to different cities now, doing in-person healing and cleansing, because a lot of the people that work with me say that my energy is way stronger in person than it is over the distance. And so I've been allowing myself to travel and do that as well. So if anybody ever welcomed me into your city and you want me to give a class, a seminar, a demonstration, or a mass healing or cleanse, I'm always open to doing that as well. And then of course, I make jewelry and things like that as well. Like crystal jewelry, waist beads, rings, bracelets, anything dealing with metaphysics, I pretty much do. I made everything that I'm wearing even now.
Okay. All right. So you guys saw the flyer. Did it have the date? Did it have the date on there next time he's on the new app?
No, that's just so that you know how to find me on there. Okay. It has my Miko ID and my name that's on the app.
And so Tony, he said it was a live streaming service, but they will actually pay you, right? Is that what you're telling me about this app?
Right. So basically, we have you know, people that are gifters, and they come in, they listen to your content, to whatever that you're doing. If they like it, they send you what we call coins, and then depending on how much coins you have in that month, on the 10th of the next month, you receive a check based on a chart. You know, it's like a chart of receive this many coins, you get this much. So the one I'm on is fairly new. So it's not as big as some of the other streaming apps that does it, but the energy and the way they run it is much better. And of course, I just follow divine leadership. Divine said that's the one they want me on, and that's the one I'm doing.
Okay. And The other reason I was asking Tony, asking for clarification, Tony, because I don't know if we could stream through there. I don't know if how that would work, but that would be dope. So look up Miko app, and obviously I'll have a little something that I put on there. But even if we could stream this, because this is consistent, this is every Sunday. You know what I mean? So just trying to hustle, baby. Yes.
This is kind of like off topic.
Okay.
But I feel that your music is healing. Okay.
Yeah.
And I don't want it to sound scripted, but I wanted to possibly hear the song that's nominated.
Oh yeah.
I'm sorry. I mean, I know this is like
off the hey, we got time.
That's fine. Okay.
Yeah, we got time. Do you Tony, do you still have the video everything? Or you can pull it up for YouTube. I can send it to you, the link from YouTube. It's you can just go straight to the page, and it's pinned on the top of the page. It's the actual music video, everything. Oh, Crystal, thank you, because I totally forgot.
And this song was nominated?
Yeah, so this is the song I'm performing, and I'm nominated, but I'm nominated because of this song, I should say. This is the song that was submitted, and why I got nominated for I think it's Best New Independent R&B Artist, maybe female, or just Artist of the Year. Yeah, so, yeah. So, yeah.
I still rock your No Regrets song.
No Regrets.
All the time.
It's No Regrets over here.
I still rock that song all the time.
It's No Regrets over here. But thank you, Crystal, for saying that. And, yes, when I do write, when I do sing, and when I do collab with other writers like Malik Youssef and Sean Penn and Davis Chris, shout out to you all. I like to, say something to the people that's going to matter and to uplift them. And this project was all about upliftment, celebratorial dancing. Dancing is healing. It's very spiritual. It's very ceremonial. It's very invoking of the spirit. It's very healing in itself. So I wanted to let us dance and celebrate and, call on the spirit while we're doing so. And I wanted to create music that would get people's attention so that we can celebrate and do that. And so that's what this project is all about. So thank you, Crystal, for saying that.
This is something that I want to hear. I've been following you, and I just didn't know which song was being nominated. But now that you said those things, I kind of know the song, so I just want to hear it, because it's definitely spoke to me, and I don't know if it spoke to anybody else, but it's something that has spoke to me, so I would like to hear it.
Thank you. Everything or Nothing at All. You got that? All right. Without further ado, my girl hooked me up. Everything or Nothing at All, you guys.
Set you free, you're everything I want, and nothing that I need. I'ma set you free, I'ma let you be.
The legendary Fireman.
I'ma let you be, 'cause I'ma set you free. You're everything I want, and pulled up in that Jag. Oh snap, fix your face, you look mad. Everything or nothing at all. 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 And nothing that I need, I'ma let you be. 'Cause I'ma set you free. You're everything I want, and nothing that I need, I'ma set you free. I'ma let you be. Everybody, somebody's everything. Everybody telling me I need better things. It don't always work 'cause everything is relative. He was sleeping on me, everything is Saturday. Fighting for your love, everything competitive. Going in the time, that's how I became a champion. Oh snap, I done found my own swag. Oh snap, I done got my own bag. Oh snap, I done pulled up in that Jag. Oh snap, fix your face, you look mad. Everything or nothing at all. 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 And nothing that I need, I'ma let you be. 'Cause I'ma set you free. Everything I want, and nothing that I need, I'ma set you free. I'ma let you be. So to get my shit, I had you, and nothing went right. My self-worth was down in the dumpster. I found me, and now I run everything or nothing at all. 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 And nothing that I need, I'ma let you be. 'Cause I'ma set you free. You're everything I want, and nothing that I need, I'ma set you free. I'ma let you be.
Yes, yes, and yes. Oh, you guys can still make me blush. Thank you guys for that.
That's gonna have to be part of my healing segment.
Uh-huh.
That was a very beautiful.
Thank
video
you.
as well.
Thank you.
Yeah.
Yeah.
Yeah, I need to find out where he got that attire from because I want it.
Which one?
The one with the white and the black and the gold mixed in it. Yeah, that was dope. I like that.
So the black
That's you with
dashiki?
the short hair.
Yep.
Yeah.
Yep. Every scene is different. The with the from the fro to the red to the short hair to the black gown. Yeah. Just to kind of show
You don't even realize that you're healing yourself through your own music.
I always say I write my future. you know.
Yeah.
You know.
It's that everything that song represented and said is definitely you.
Mhm. Mhm. But it say my self-worth was down in the dumpster, but I found me, and now I run stuff. I run shit.
I mean, those the words were very powerful. I don't know if you know that, but the words were very powerful, and everything that you spoke at that time, even though I know that you were probably in a relationship, or
Mhm.
you're still married. So
Yeah.
don't let me take that away. But at the same time, you spoke your own future and your own truth.
Right. Right. And again, shout out to Malik Youssef and Fireman for producing and co-writing the song. But yeah, they were able to just embody a lot of the things that was present in my life at that time, and and even going forward, and I mean, just even lyrics like "Diamond in the Rough." Shout out to my jeweler. You know what I mean? Like, and to this thing became very refined. And to that time, there wasn't going to be a shine, but now it's shining. is shining bright, but it just had to be, or it has to be refined, because I think I'm still, refining and knocking some of the dust off, or whatever. So, yeah. But yeah, I tend to listen to my own music to get myself through these things, because it serves as a reminder, like, okay, remember we told you this. You remember now. It's not to say that I don't feel it going through it, but I'm sure you can attest to this, Shaman Baba T, just because you know it, and you may even know the answers, and you may be even be able to help people get to the answers, but it may not necessarily mean that you're able to feel that or activate that in yourself all the time. I know
Right,
you have to give yourself a reminder.
Right, absolutely. And sometimes I have to be reminded through others.
Yeah, yeah. So, and what is that process? I know you said sometimes you have to be reminded through others, but what is it that you do when you find yourself stuck, when so much is expected from you? What is it that you do for self?
Yeah. I usually close off from the world. I close off from everybody. I imagine myself cloaked in an invisible cloak where nobody can see me, touch me, hear me. Like, just need everybody leave me alone for a little bit. And that really just goes to what I said earlier, silencing the noise around me. That's the first thing I do. I silence the noise around me. I ask the right questions. I ask the questions. What am I feeling? What should I be feeling? Why am I feeling? And then the answer either comes directly to me, or it may come to me through someone else. Because if I'm silencing the noise around me, I know that those who can get to me are the ones that are only supposed to be getting to me to give me the message that I need. And that's what I do. And then I'm back on track again.
Yeah. So the thing I admire about you, Crystal, is that you definitely believe in you believe in the medical profession. You believe in the medical field. So you're not just, of it, you're in it. And one of the things that I know that you'll give another doctor a chance to help heal you, even when you're going through some personal things, some personal physical ailments. You'll give a doctor, it's not like you'll go, I'm staying at home, I'm going to heal myself. You'll go, let me give these doctors a chance. And then if they don't get it right, or then if they don't do it, then you know how to, like, okay, look, I done gave y'all a chance. Now I have to go inward. So, what is that compels you to actually go seek another doctor's help for your own body, for your own health?
I think that thinking is the same thinking that a lot of people should have within themselves. I know that people do have the ability to heal themselves.
Mm-hmm.
At the same time, they don't always see themselves.
Mm-hmm. Mm-hmm.
Or you do have to get, as they say, a second opinion from somebody that maybe, I wouldn't necessarily say smarter than you, but maybe somebody that has grasped that field and maybe can comprehend the things that you can't comprehend in that field because they might have been doing it longer, or this is their specialty, this is their niche. So I would never just like pigeonhole myself and say, you know what, no, I know what it is, because I've been in that situation where I've been self-diagnosed myself with everything in the book,
right?
And none of those things were even coming to pass. But that's because I'm so used to taking care of others and coming up with answers, we'll say. Coming up with answers. And sometimes as a person, when you're going through some things, you can't come up with your own answers.
Mm-hmm.
You don't, depending on what's plaguing you or what's happening in that realm, you shouldn't just trust your own understanding.
Right.
You should get others' perspective. And so for me, that's where that comes in, because I've been in a place where I'm like, I ain't seeing no doctor. I know what's wrong. And thank God that nothing bad happened from it. And I probably did have the right diagnosis. But at the same time, me actually healing and taking what I probably needed to take or do didn't go as smooth. It wasn't, kind of clear and cut and dry. So I think that's for anybody, Just because you think you have a world of knowledge, just because you feel that you're above, you're here, you're this healer, that you can heal others, that doesn't necessarily mean that you can heal yourself.
Right.
Just because you have that gift.
Right. So, that just left my mind. I was so caught up in what you were saying that it just left my mind. What I was going to ask you was something else in that same vein. So you trust other doctors to help you because I'm sure that it is a relief to sometimes have someone else take care of you because you're so busy taking care of others. So I would think that maybe it's a welcome relief at times for you.
Well, for my personality and my character, I don't necessarily look at that. That's why when I am going through things, I'm able to not just look to professionals, I'm able to look to spiritual healers. And I think that's one of the things that's why I kind of like, hey, Amira, like, I don't mind being vulnerable. I'm like, hey, Amira, is something going on? You're like, well, you the doctor? Well, hey, you are too. And you're not letting it out. Hey, help me. And so I'm just glad that my personality and my character doesn't allow me to believe that I'm up here just because I have additional knowledge, not necessarily smarter than somebody, but additional knowledge in a particular specialty. That's why I'm able to like go out and ask questions and look to other avenues because I can recognize that it might not necessarily be a medical entity. It might be a spiritual being placed on me, and I'm not able to kind of have an outlet.
Okay. Yeah. And that's where, Reiki comes in when you can, help someone release some of that energy, while at the same time working with their own energy, help you become a help aid, in the energy field, if you will, to help that person heal themselves. So that's what Reiki is all about. But you know what, Shaman, I'm going to let you speak more on that because he is the Reiki Grandmaster. So speak from that, that spiritual energy healing that Reiki provides.
Yeah. So I just want to back up a little bit and just say that she's absolutely right, and even in silence of the noise around me, it allows me to see who I need to get to or who needs to come to me to help me, because I will agree that none of us are above being able to reach out to somebody else to receive help. And there are people in the comments right now on Facebook who I've reached out many a times to, or they'll reach out to me and say, hey, I feel this going on with you. And I say, you know what? Go ahead, shoot, I'm open to receive. And so thank you, doctor, for going into more detail in that, because I completely agree with you on that. So from a Reiki standpoint, right, Reiki being universal healing energy, right, universal healing energy, Reiki typically allows the healing energy to go where it's needed for that person, right? In Reiki, for the most part, we don't diagnose nor dictate the healing energy. The person's own soul, the person's own inner self knows where healing is needed, and we just provide that vehicle to be able to spark that, self-healing within them. Now, the thing about Reiki, though, is that a lot of people who do Reiki tend to be also very divinely gifted. They had a calling to be a healer in the first place. So even if I'm doing Reiki, general healing energy, the divine sometimes will show me images or give me messages, or maybe someone's loved one who's passed away may come through and say, hey, tell them this is what I see going on with them. And then we can channel that message to that person who's in need of healing. So healing comes in all forms. The way I like to say it, healing comes in all forms. So sometimes it can come in a form of just letting someone talk and you just listening, and they end up healing themselves by talking themselves through their own healing, right? And you're just really just there holding space. So sometimes just being in the presence of someone who needs healing allows them to heal themselves. And then if something, touches me and say, now this part they're going to need your help with, then I'll jump in and do that part. So, but that also, with the medical, I have also told people, look, don't, you might need to go see someone, okay? Don't be afraid to go see someone, because there's times I've done a reading or healing, and the answer was she needs or he needs to see medical profession.
Mm-hmm.
And the healing and spirituality and the medical profession goes hand in hand. It shouldn't be one without the other, in my opinion. So that's how we deal with that. We allow people to heal themselves, but we give them the boost and the empowerment needed with Reiki so they can achieve that.
And talk to the people about the chakras that we work with the Reiki healing as well. And then we do have a caller on the line before we go.
Sure. So chakra is a Sanskrit word that means wheel. A wheel, we know a wheel spins. And in this case, we have 7 major chakras or wheels of energy along the spine. Starting at the base of the spine, have our root chakra with the color red, dealing with trust and foundation and childhood and, family. Then we have the next one in the pelvis area, which is where the womb sits, associated with the color orange. This is also where our creativity starts. This is where our sensuality and sexuality. This is also where our life force energy begins as well. So the essence of our energy begins in the sacral. And then right above that, we have the solar plexus with the color yellow, and it deals with confidence and self-esteem and personal power. In our heart chakra, right at the sternum, is the color green, and it deals with self-love, but it also deals with grief. And it's the balance of all things within us. The heart chakra balances the left, the right, the up and down, the masculine and the feminine, the yin and yang. So it's the center. Then we go to our throat chakra, which is the color blue, but like a lighter color blue. And it deals with our ability to speak one's truth. It also deals with self-acceptance. When you have self-acceptance, you can speak a little bit more clearly because you accept who you are. Then we go to our third eye chakra, which is between the eyebrows. This is where we have dreams. This is where we have imaginations. This is where spirit speaks to us.
Mm-hmm.
They speak to us here.
Mm-hmm.
So those thoughts are not always just random thoughts. Those are thoughts that are coming from the divine. Then we have our crown chakra, which sits on top of the head. And this is associated with the color purple. And this chakra deals with our connection to God, connection to the creator, connection to spirituality and our ancestors. And this is a chakra that deals with mental health.
Yes. Yes.
Ashe.
Ashe. So I'm going to take this caller really quick because it's going to cut us off on the blog talk by 8. So let's take the caller really quick. And then if there's any last comments, we'll do that afterwards. Keith, are you there?
Hey, hi, Amira. Good evening to you. Yes, I am here.
Good evening.
Good evening also to your guest, to the shaman, and also to Dr. Crystal. What a great, informative show this evening.
Thank you.
Wonderful information. Just kind of alluding to something that Dr. Crystal said, and also our brother shaman just said. I believe the culmination of the healing is exactly what they were both espousing. It's internal. It's connected to professionals. It's connected to our own personal spiritual being, the chakras included. It's connected to those who speak healing to us. I remember a time, and I'll try to say this really quick, but I had lost sight 100% in my right eye. Went to a choir rehearsal. This was about 15 years ago, and got prayer in that particular choir rehearsal. I had an illness in the eye. Doctor said, you'll never, ever see again in life through that eye.
Wow.
My eye today is 100% healed because the healing was spoken to me. And I took the power of the words, it manifested physically, but I took them innately. And just like the brother Shaman was just saying, that it can come from a word spoken to you.
Yes. And
I believe that it can come in many different forms. Whether it's herbal, whether it's physical medicine, whether it's from physicians trained and taught, whether it's from healers, whether it's from ministers. So we need to just be open to where the healing comes from.
Yes.
And I appreciate that because they touched on that, not so in depth, but they touched on it because it's very true, and I'm a living witness to it. Great show. I love it. Keep doing it. Keep doing it.
Congratulations, Keith, on that healing. That's a beautiful story, beautiful testimony. I'm sorry, what say you, Crystal?
No, I was saying that's right. That was such a beautiful story. That's like, hey, that's letting me know that we're doing right. We're doing what we're supposed to be doing.
He said something so. I'm sorry. I'm sorry.
No. I was just saying, especially since we can refer back to each other, and we don't have to be, you know, treating the body as a whole instead of treating the body as the person as money. You know,
Yeah.
I like that. Hey, you know what? You might not be for me, but guess what? You are definitely gonna be for my spiritual man here.
Right.
You know, I like that.
And he said something that was very key in any type of healing, is that he had to accept it for it to work. And that's how healing works, regardless of the modality using. Both the person that's giving and the person that's receiving has to be in receive mode.
Come on.
Has to be in receive mode
Yes.
for it to work. If a person is closed off and not willing to receive what's being given to them for their highest good, it will not work. And so I just want to thank him for bringing that up, because that is very key in healing.
So thank you, Keith. Thank you for calling in.
Love you dearly. You know it. Talk to you later.
All right. Talk to you soon. Thank you. Aw. I love when they call in. Okay, you guys, we have gotten down to those last few minutes of the show. I want to give the healers a chance to leave us with some last comments, some words of wisdom, something spiritually uplifting. And I want to start that off with Dr. Chris. What would you like to leave the people with?
The only thing I would like to leave the people with is, I know that coming from a multicultural background, a lot of them, especially in my family, don't believe in mental health.
Okay.
And my thing is, if you are plagued with anything, I don't care what it is, seek a professional, whether it's a healer, you have to go to Reiki treatment, whatever it may be. I do not care. Just try to seek additional information when it comes to that, because I want you to know that mental health is a real thing.
All right. All right. And if you don't mind giving the people your handles and exactly where they can contact you if they actually want to come sit down with you for a session and, get some real healing.
Well, if you look up my name, like I said, I'm very popular. They can look my name up, and they'll be able to find the phone number and kind of where I'm located, because I go to multiple. I'm kind of like a healer here. I go to multiple places, and I also do private counsel. So at any time, if they, just look my name up, and I also have a phone number for them if they needed to call it, then that's absolutely
90 seconds. You cut that one off. I'm sorry. Go ahead. Can you hear me? Go ahead.
Yeah, so the phone number is 657-205-8788.
So I'm sorry, say it one more time.
657-205-8788.
Okay. All right. So, and that's how you get in touch with Dr. Chris. Now, I call you Dr. Chris. I call you Dr. Colone. I call you Dr. Crystal Colone. They're going to find you under
any one of those.
Okay. Good. Good. Thank you again for coming on. This is something that I want to do once a month, you guys. One Sunday a month, I want to bring on Dr. Chris. I want to bring on the segment Ask Dr. Chris. So I need you guys to blow this up. I need you guys to, chat it up with me online. Tell me how you guys enjoyed the segment. Jump in my inbox. Let me know. I'm going to be doing this once a month on Sundays. The Dr. Chris Ask Dr. Chris segment. And I really appreciate you being here, because I know she's usually really busy. That's why I only can get her to commit to one day a month, but we'll take it. So you guys show your appreciation by definitely calling in with the questions. Even if you have questions that you want to send me throughout the week when you know her segment is coming on, I'll take them and make sure I implement them and ask them for you, even if you're a little shy about getting online, or even calling in or chatting it up. Just, send me your questions ahead of time. And, this is no judgment zone for us. We're full of love and light that, begets life. And we want to heal you. We definitely want to heal you. So, again, thank you, Crystal, for coming on. And then Shaman Baba T, what would you like to leave the people with? And also your handles and where they can get a hold to you.
Okay, so the easiest way to get with me is bookingwithbaba.com.
Okay.
Bookingwithbaba.com.
Okay.
And you can send a message there. and you can also book a session there as well. And also, I post the group Zoom classes on there for people to, book a slot. The classes are usually between $20 to $30, depending on what we're doing. And we come in and get some teaching and some great healing. So the message I want to leave with is that, when we're talking of mental health, to remember to have compassion for self, and to remember to forgive self. In Karuna Ki Reiki healing, the energy is made up of that of unconditional love, forgiveness, and compassion.
Okay.
So I pulled from the love deck, and the love deck says, love is all around you. There's love everywhere, all the time.
Yes.
Simply acknowledge this as truth. So if we start to retrain our mind to acknowledge that love is all around us, we will learn to not only approach others or other things that's going on in our life with love, but we can also learn to approach ourselves with love.
Okay.
So with that being said, I want to use my hands, create a ball of Karuna Ki, love, compassion, and forgiveness energy. Let this energy be sent into the heart chakra, into your heart space, and then spread out through your entire body. Ashe.
Ashe. Well, again, thank you, Shaman Baba T, for blessing us again with your presence. So again, I want to make this, once a month thing,
Mm-hmm.
So
Yeah.
I know we talked about it before, but yeah, I am asking, saying it on the spot, putting you on the spot.
I'm with it.
Once a month, come back on and do a segment. I don't know what I want to call it yet. We'll figure it out. But spending some time with Shaman Baba T. Let's spend some time with you. Just once a month. Let's check in with you and get some more healing techniques and you do it all. The readings, the healings. The spiritual healings, the going inward, the mental health aspect. You do a lot of things for the community. So we want to continue to share with the community as well as celebrate you on here on 2020 Vision. So yeah, come back, once a month. Let's get you on here. And the people, believe me, they need it. They need it. So thank you.
Thank you.
All right, you guys. Well, my name is Amira the Songstress, and that has been another episode of 2020 Vision. Oh, yeah. Wait a minute. I got a commercial. Okay. Because I'm a hustler, baby. Show that. Yes, there we go. So that's my number if you want to get in touch with me. The name of my company is called Goddess Bodies, of course. I do body contouring, butt lifts, all non-surgical. And, I can get you right and tight as well as Reiki as well. I was first attuned probably about more than 10 years ago with my Reiki level 1. And then I actually got attuned to Reiki level 2 and Reiki master by Shaman Baba T himself. So, as Crystal said, I am a powerful healer, baby. Don't get it twisted. So come on if you need to get your body and your mind and your spirit right. I'm offering that service as well. You can get me at 619-407-9433 and also on IG at Goddess Bodies. Yes. Okay. Now, for my last comments, again, this show was filled with love, life, and light. It was, again, one of my favorite things to talk about. Mind, body, and soul, having a holistic experience with spirit. There is nothing much left for me to say. Everything has been said. My gurus have left it all on the table here for you to consume. You can watch this again and again because it's going to continue to air on YouTube, Facebook, Twitter, and then thank you people from the Instagram Live, the actual behind the scenes. Thank you guys for chiming in. And remember, stay focused.
No regret, no regret, no regret.
Let me fix my crown, baby. Like dominoes, yeah, it's going down. My feet off the ground, elevated. You feel my soul when you hear my sound, and I don't know why. like a red light that don't ever change. And you should know why I'm merging to the other lane. I'm getting close, I'm up next, no regrets, making hits is a reflex. I'm getting close, don't take a second to second guess, riding high so you know I'm blessed. Oh yeah, I'm getting close, I'm up next, no regrets, making hits is a reflex. I'm getting close, don't take a second to second guess, riding high so you know I'm blessed. No regrets, no regrets, no regrets. Ooh, I'm so tapped in, baby. Yeah, I'm turned on and tuned into that frequency. Bring love and light and healing in my energy. Hear a major difference in these minor melodies. And I don't know why you're familiar faces in strange places. They don't ever change. You should know why I'm I'm getting close, I'm up next, no regrets, making hits is a reflex. Oh yeah, I'm getting close, don't take a second to second guess, riding high so you know I'm blessed. Oh yeah, I'm getting close, I'm up next, no regrets, making hits is a reflex. I'm getting close, don't take a second to second guess, riding high so you know I'm blessed. I came with the keys to the industry. I came with the keys to the industry. I came with the keys to the industry. Oh yeah, I'm built for this. Came with the keys to the industry. I came with the keys to the industry. I came with the keys to the industry.
Okay.